Hey everyone, I just want to take a few minutes and explain some of the differences between different adjusting techniques and how we resolve what might be the same problem. Or in other words, if we assume that there is the same issue, how would each different adjusting technique address that issue? Now, I'm not wanting to make any judgments against any other techniques, but I do want to show what the difference is between adjusting to neutral particularly, and why I feel this is a very, very good tool for resolving problems very, very precisely. So firstly, I'll talk about diversified adjusting. So diversified adjusting is what most chiropractors are doing. And so say, for instance, if we had some tension on the left side of the neck over here, most people would be palpating the neck and turning the head to the side and feeling where there is a resistance of that joint bending to the side, and rotating to the right. So in other words, if we see a tension over here, we would see a more resistance of the joint bending to the side and rotating to the side. So typically what the doctor would do is to, with a diversified adjusting, what they would do, they would bend the joint to the side, and then they would rotate the joint quite a lot in this direction to try to increase that end range motion. One of the things that diversified does is it adjusts the joint with the neck lifted up. So the neck is in flexion. So what flexion does is it opens up all these facet joints. So the facets are open like this. There's this sort of a space between them. But then when you bend the head over to the side and you start to turn the head, what we'll do is they bend the head to the right side and then rotate to the left. And what that does is when you lift it forward and you bend it to the side, what it's going to do is it's going to push these facet joints together on this side and gap the joints on this side. So the adjustment is releasing the tension of these muscles here by opening up this joint and giving a big stretch. When we do that, it's called a rotary break. What it's doing is it's actually doing a stretch on all of the joints of the neck. It's quite hard to be specific to a specific joint or to be specific to a specific muscle or segment. Okay, so cervical breaks have been around for 125 years about, and they work. People get a lot of benefit. They feel a lot of relief. It definitely can increase the range of motion. But the reason that I don't do it is because it isn't very precise. Personally, I used in my clinic a couple of motion adjusting for the last learned it 28 years ago, so I've been doing it for a very long time. And what coupled motion does is it pays particular attention to the way that the joint is designed to move. So the joint moves in what we call a coupled fashion like this, where we consider that the joint is rotating in this sort of a way. So what we're looking at is the facet joint staying close to each other on this side and on this side. So we're trying to keep the joints like this. So we don't do a lot of flexion, but there is some rotation of the neck. And then what we're doing is driving the joint and rotating the joint around like this. So what we do is put a load on the joint and stretch it and start to stretch these muscles that are tight on this side, stretch it, stretch it, stretch it, and then we adjust by rotating the joint around like this. So we do a fast stretch here and we do a rotation here. And what that's going to do is it's going to create this type of a motion here and open up and release this. Now, what I like about coupled motion adjusting is that it is more specific. It's much more specific to a joint. Now, very often, because we're at the end range, we're actually loading up quite a lot of muscles here, and we are moving quite a lot of joints when we're doing it. So it's not uncommon to get, 2 or 3 or more cavitations because we're actually moving many segments when we do this stretch. So when that happens, there's also still a question of how much specificity do we have? Are we actually resolving a problem at a specific joint, or are we moving many joints at once? So again, nothing against coupled motion adjusting. I used it for over 2 decades and had fantastic successes with it. Typically what I found was I was able to resolve things within about 5 or 6 adjustments and have the patients, sort of above 70 or 80% by then. What adjusting to neutral is is again a different process. So if we have the tension over here, what we're doing is, rather than taking the joint and loading the joint, so if we have tension over here, rather than rotating the joint and adding more and more tension and adjusting the joint near or at the end range and driving it into the paraphysiologic space, or just kind of past its normal range of motion, what we're doing is something quite the opposite. So the setup of the adjustment is, what we're doing is we're going to firstly take the joint away from where the tension is. So in other words, if there's tension in here, we're going to allow the joint to rotate to the left. One of the other components of adjusting to neutral is that it isn't a rotational adjustment. So we don't do any rotation at all. But one of the things that we find, or certainly that I find, is that when the joint is subluxated, very often it will rotate, but it will also translate anteriorly. So what that means is the joint is rotated, but also anterior translated. So it's gone in this sort of direction like this. So what we're doing is, in the setup, we're letting the joint rotate to that side. So again, we're still talking about the same issue on this side here. What we're doing is taking a contact, letting the whole spine roll over, and where this muscle is tight, what's going to happen is the joint will easily bend that way because the muscle is trying to take it in that direction. But if this muscle is tight, then what's going to happen is this muscle over here will be very, very loose. So multifidus on this side will be very loose. So what we'll find is that in our setup, rather than actually kind of loading the joint into tension, what we're going to do is actually going into where there's the most kind of ease of the joint. So when we set up a joint and adjust into neutral, we're actually letting the joint go into its easiest position. So again, there's less resistance here because the subluxation is pulling the joint like this. So the joint will actually continue to go in that direction because that's the weaker position of the joint. So we're actually just letting it kind of flop over into its easy position, and the joint is, the person is very relaxed here. So we're just holding that joint. There's no force in the setup. We're just letting the joint rotate to the side, and also we're feeling for where that anterior translation is. So when we start to try to bring the joint back towards a neutral position, what we're doing is we're palpating the bone below for a translational resistance. So we're feeling for a resistance in translation of one joint sliding under another. And that's what we're trying to resolve. So we're literally just driving that joint back towards neutral, but driving it through a translational force. So there isn't any rotation. There's a rotation in the setup, but again, we're not loading the joint in the setup. We're just taking it to its easy position because, again, these muscles here are tight, and the tight muscles are tight, rotating it, but also translating it anteriorly like this, anterior lateral. So we're just going to let it go into that anterior lateral rotation like this, take a contact here, and we're driving that joint back towards neutral position. So it's very, very different than adjusting than what couple motion is and from what diversified is, because we do not adjust or create any force in rotation in the adjustment. We are not adjusting at the end range of the joint. We're actually taking the joint into its subluxation, finding specifically where it's translated, and we're driving the joint through a translational vector. So for people that have had this, particularly people that do couple motion adjusting, they're often quite shocked how different this adjustment feels to coupled motion, and certainly to diversified. It feels very, very, very specific. We're adjusting one joint in a very, very precise vector. And the reason that we're doing translation is, for one, translation is often ignored, but also translation is really the only way that we can be very specific with one joint. As soon as we induce rotation, we're going to be stretching a lot more muscles. It's very hard to be specific with rotation, and much, much easier to be specific with translation. And so resolving these translational issues, I'm finding, and the people that are using adjusting to neutral are finding, that seems to be a very important key to creating a long-term resolution and also balancing out these intrinsic muscles. So that's why, so anyway, that's just some of the clear differences between the techniques. I know that there's probably some confusion, and it's certainly not until a practitioner feels it themselves that they can see how qualitatively different it is. So anyway, I'm looking forward to the seminars that are coming up and teaching more doctors. Certainly we have a great group of people that are using it at the moment and getting great results. So I'm really looking forward to spreading the word and getting more of the community using this technique and seeing what benefits there are and sharing our experiences and building this community together. Certainly this isn't about me. It's about advances in the profession and being specific and precise. That's entirely what this is about for me. And I just welcome every opportunity to discuss it more, and certainly open to critique. And if anyone wants to experience it themselves, they're always open to contact me, and I'll be glad to answer any questions. So thanks for watching, and put questions in the comments, and I'll be glad to address. Thanks again.